I get more and more people coming into my office of concerns of developing heart disease. They might have high cholesterol or they have a family history of heart disease. They're worried about a stroke. In this video, I'm going to teach you how to identify, how to diagnose if you're at risk, what to look for, the mechanism of heart disease, and then ultimately how to prevent it. And we're going to start right now. Well, hello everybody, I'm Dr. Glenn Harrison and welcome to this week's segment of Why. This is where we take just a few minutes to answer some of the most common health-related questions that I see in my office every day. So today is all about heart disease, what we should do, how we can do it. But if you are new to this channel and you want to learn more on how to take care of yourself, how to not only understand and have some natural strategies to turn some of your health conditions around, but understand the mechanism, the why of your condition, make sure you click the subscribe button, hit the bell notification so you don't miss anything, because over the next weeks and months, we're going to be throwing more and more content out. So, heart disease. Why is it important? Well, it's the #1 killer in North America. It's the #1 killer. In addition to being the #1 killer, there's some statistics here really frightening. Someone dies every 37 seconds due to heart disease. And every 40 seconds, someone has a heart attack. And this isn't necessary. That's what we're going to talk about today. Things you can do to prevent this, identify it. Now, there's a few things that cause heart disease, why we're victims. The first one is risk factors. Probably the biggest risk factor is smoking. If you are smoking, there's nothing else that you can do other than get cigarettes out of your body and stop that, because that will kill you. It just really will. Sometimes people can smoke a long time and not have a problem, but that's a loaded gun. So smoking is #1, which you probably know of. Diabetes. If you have high blood sugar, pre-diabetic or diabetic, and it's not being controlled and you're not managing it, we can help with high blood sugar and help you manage it, but that's got to be corrected. So smoking and blood sugar. Genetics. Of course, genetics play a role, but they don't play that big of a role. Only 5 to 8% of all health-related outcomes are due to genetics. So if you have family history of heart disease, of course it brings you up to that risk, but it isn't everything. It isn't the whole story. Something interesting that I always hear is genetics load the gun, but your lifestyle pulls the trigger. So we can have a genetic predisposition, but it doesn't mean it's going to be our faith. So genetics do play a role, and family history. Another one that sometimes some people aren't aware of is poor oral health. If you have a lot of cavities, infections, gingivitis, bleeding gums, all of that infection goes right in your bloodstream and goes right into your cardiovascular system, right to your heart. So if you have any oral problems, oral health disorders, make sure you get that corrected, because that's going to drive up your risk of heart disease. So there's some few risk factors. Once you take care of those, what's next? Well, the next step is really, I guess you got to understand, where does heart disease come from? It comes from inflammation. Inflammation is a key phrase where your body's immune system is being irritated. I talk about this all the time in my videos, but it's necessary to recognize this. So inflammation can be irritation due to physical stressors, chemical stressors, and emotional stressors. So that's inflammation. But when your body is inflamed and something's irritating your body, it creates arterial inflammation. Your cardiovascular system becomes inflamed. So systemic, your body's inflammation, create arterial inflammation, your cardiovascular inflammatory response. So how do you mitigate that? Well, what arterial inflammation looks like is where there's little injuries, little tears on the inside of your arteries, little tears. And there's never just a tear in one spot. It's going to be all through your circulatory system. So these injuries are due to inflammation. And then once you get these little tears, your body makes cholesterol, and then cholesterol gets snagged and gets stuck on these tears. And then you test your cholesterol and it's high because it's plugging up your arteries. There's going to be videos at the end of this explaining cholesterol, because it's a factor in heart disease, but it's not what you think. I don't have time to get into it today, but cholesterol is a key indicator of heart and cardiovascular injury. So So that is inflammation and some of the mechanisms of it, physical, chemical, and emotional irritation. Now, how do you, in my office, it's all about diagnostic testing and then lifestyle and natural strategies to correct that dysfunction we find in a lab test, and then we can feel better. So testing, what do we do? The most important test, I can't stress this enough, is a calcium score test. It's a CT image. It's a CT image of your heart. It's non-invasive, but what it does is it looks for calcium in your coronary arteries, your heart arteries, and the more calcium that's in your artery, there's the more plaque. If there's more plaque, that's an indicator of blockages or where your artery is starting to close off. You close off a coronary artery, a heart artery, that's a heart attack. So a calcium score test is the earliest predictor of recognizing heart disease. In the United States, as of just a couple of years ago, every president, they had to do a calcium score test. That's how important it was. But it's funny, in the United States, insurance doesn't cover it. It's ridiculous. But you can get it done. There's going to be a link below and information and a video on calcium score tests and how you can get that done. But that's number one. That's the first place I would go. Calcium score test if you have any risks or any concern. The next one is cholesterol. Well, cholesterol isn't what you think. There'll be a video at the end. I'll talk more about cholesterol. But don't just do the standard medical test for cholesterol. It's actually a little bit ridiculous how minuscule it is. But you want to test the sizes of your cholesterol, because not all LDL cholesterol is bad, the sizes, and the oxidative level of the type of cholesterol you have. There'll be links in the description that you can actually even order this test. We can order from anywhere in the country, here in the United States, pretty well anywhere in the country. And if you are out of the country, I know we have a lot of people watching this from out of the country, there is the markers. You can bring them to your medical provider and hopefully they can get them. But so the calcium score test, look at all your lipids, all your cholesterol markers, the comprehensive lipid test. And then the third one is C-reactive protein. The medical community likes to do the C-reactive protein sometimes. It's an indicator of heart inflammation. So that's just a blood test. So the CT exam for your calcium score, your lipid levels, all your cholesterol levels, and then the C-reactive protein. That is going to give you an amazing understanding if you are at risk. Now, so you can't guess with this stuff because a lot of people have heart disease and heart attacks and they look like the picture of health. So don't just look from the outside. You got to find out what's going on the inside to prevent it, because you can't prevent this. And then, so what do we do with some strategies now? Say we have high risk, or maybe we don't, but we want to prevent it. Diet is number one. It really is number one. Two major forms of diets. I don't have time to get into them today, but you can send questions and I will point you in the right direction. A paleo diet, that's ideal, that's great, or a Mediterranean diet. Those are both excellent for heart health. Both of them really are. Don't fall into the fad of fats are bad for your heart. Not all fats are the same. I recommend staying away from canola oil. Canola oil will give you a heart attack. It's really the worst thing you could ever do for your heart. Stay away from canola oil and stay away from flour oil. That's where you'll get you'll get like sunflower oil, safflower oil. Stay away from the flour oils and stay to the seed oils. Avocado oil, coconut oil, olive oil. Those are going to be your safest bets, specifically avocado, coconut, and olive oil. Usually those are they help our hearts, but stay away from those other fats, those plant fats. And in most cases, animal fats aren't a problem, especially if the animal is clean and not loaded with antibiotics and is not, had a bad diet all by itself. Grass-fed and grass-raised beef tends to be the best. But don't fall into the fear that fat is gonna give you a heart attack. And animal protein is gonna give you a heart attack. It's the quantity is a problem. North America, 3/4 of our plate is animal protein. That's a problem all by itself. We've got to have some fiber, some fruits and vegetables in there. Now, the final piece is supplementation. You can do a lot with supplementation. So there's going to be links. You can actually order these products right in the description below, and there'll be videos even how to use them. Fish oils. Fish oils are an anti-inflammatory all by itself. It's the original anti-inflammatory. You're going to want to consume 3 to 4 grams of fish oil. There's going to be a link below that you can order it directly. It's super high quality. Not all fish oil is the same. I can't say that enough. Vitamin D. Vitamin D with K2 is going to be your best. Vitamin D is heart protective, and so is K2. Okay, both of them protect your heart. About 5,000 international units of vitamin D a day for most people tend to be the best. Ideally, you're going to test it and you're going to know where your vitamin D levels are, because you want to keep the vitamin D up between 50 and 80 micrograms per deciliter. I think that's the measurement it is. But there's going to be a link to the vitamin D as well down below. And even a test I'll put down so you can order your vitamin D as well and find out where you're at. So that's vitamin D. Now, if you have a significant heart risk, right? My dad, actually, I think I can talk about my dad on here. If he had a significant heart risk, like high LDL cholesterol, high calcium, and all this stuff in his arteries, there's a product called Ultra Cardio Meal 360. I might be butchering that, but it's going to be in the link below, and it's a medical food by Genics. It is something unbelievable. Now, it's not one of those things you live on, but if you have those high risk and you take this product, it is very good at helping bring down your cardiovascular risk and your LDL cholesterol. It's remarkable, and it actually tastes really good, but it's going to be below. I highly recommend something like that, and then a fish oil that's called Omega 10. It's also from Genics. There's going to be a link below, but it brings down your triglycerides. If you have high triglycerides, it also puts you at a risk for heart disease. So that's kind of a supplement strategy. There's another one that I like to recommend people with high cholesterol is niacin. Niacin is a B vitamin. I'll have a link for that below as well. If you take too much of it, you can get a flushing sensation, but I have a video on it below. So there's a lot of content below here that'll help you out. So you don't have to deal with heart disease. You don't even have to, you should never worry about having a heart condition if you do these tests. Now there's younger and younger people having heart attacks and are at heart risk, and the misconception is they just had a heart attack out of nowhere or just had a stroke out of nowhere. That is never the case. We have the diagnostic tools now, I gave you so many of them, to find out if you are at risk, and make sure you're working with a healthcare provider. If you are at risk, don't just wing this stuff. Make sure you're working with someone qualified, and we can work with anybody in the country or out of the country as well. But yeah, we can avoid this stuff. And also, if you look ahead here, there's going to be a couple videos, one on calcium score and then one on cholesterol. These are very great, important videos. If you watch those, they're going to give you a fuller understanding, better understanding of how heart disease works and how to get rid of it. So don't worry. If you're willing to put in the work and take care of yourself, your heart should work fine. So with that being said, I'm Dr. Glenn Harrison. I look forward to talking to you next day, and we're going to answer the why to another health-related question. Have a great day.